Hi, Bill. Here to meet you. Can I help out today?
Oh, look, Doc, just I'm just feeling a bit breathless and my leg. I've got some real redness in my legs. I've had cellulitis before. I just know I need antibiotics.
Oh, okay. Can you tell me a little bit more about your breathlessness?
Yeah. Oh, look, I'm just feeling a bit puffed. I mean, I'm a bit concerned about my leg. It's just swollen and sore.
Okay. I would have a look at your leg in a minute. I'll just ask you a couple of questions so I know what's going on. Then
Yep.
I can help you a little bit more. Now, when did you start feeling short of breath?
Oh, today, I suppose.
Today?
Yeah.
Okay. Any chest pain with that?
Oh, just a little bit, I suppose.
Okay. Now, how far can you walk before you start feeling short of breath?
Oh, I just feel quite short of breath just sitting here.
Oh, okay. You don't feel very well, do you? All right.
No.
Just go to the treatment room and lie down on the bed. Is that okay?
Yeah.
All
Yeah.
right.
Yeah.
I'll get the nurse to put on some monitors on you, and then I can start questioning. How do you feel now sitting on the bed?
Oh, I'm okay. Just still feel a bit short of breath.
Okay. All right. We'll look at it now. Have you had this before?
Oh, not felt like this before. No, I've had swollen red leg before. I'm sure that's cellulitis.
Okay. Okay. Any calf pain? Any pain at the back of your legs?
Oh no, not. I mean, no. A bit like last time. It's a bit sore because it's swollen.
Okay. Have you travelled recently before? The last few weeks, 2 months?
No. I just driving here. I just tend to sit around at home.
Okay, just driving. Okay, how long did you travel to drive here?
Oh, not very far. It's about 10 minutes away.
All right, that's fine. I'll just ask you a few questions about your general health and then I'll examine you now. Okay. Now, the shortness of breath, how has it impacted on you doing bits and pieces at home?
Well, it's only really happened today, and I just feel I haven't really had a chance to impact me. I don't know how I'd do anything at the moment.
Any fever with it? You feel hot and cold?
Oh no, no, I don't.
Okay. Any sleep problems? I know you've got obstructive sleep apnea from your record.
Yeah, I just there's a lot of snoring. Yeah.
Okay, a lot of snoring. Have you got anything you use to manage that? A CPAP
I've got
machine?
a CPAP machine. I use it sometimes.
Okay. How is your energy level like?
I just feel so short of breath. I don't think I could do anything.
Okay. Any change in your bowels or urine? Water?
No.
Any pain anywhere? Your joint pain, bone pain, on the back of the leg?
No, my leg feels a bit swollen and sore.
Swollen, yeah. So okay, all right. I'll have a look at that in a minute. Now I'm just going to ask my examiner for the examination findings of this patient. I'm washing my hand. Could I have a general appearance of this patient, please?
So he's obese and he's short of breath at rest.
Okay. All right. Can I have his vital signs, please?
So his afebrile temperature 36.5. His blood pressure is 135 on 75. His respiratory rate is 30. His saturations are 90% on room air. And his heart rate is 130.
130.
His body mass index is 40. His weight is 130.
All right. Thanks for that. Should I have his cardiovascular examination findings? Blood pressure?
Yep. So dual heart sounds and clear chest.
Okay. Respiratory examination?
So respiratory, clear chest.
Okay. Abdomen?
Not recorded.
Okay. Can I have the examination of his lower limbs, please?
So there is no evidence of redness on the lower legs. The left leg circumference is 25 centimetres. The right leg is 22. The rest of the examination is normal.
Okay. All right. Could I have his ankle bronchial pressure index?
Not available.
Not available. Okay. Could I have some surgical tests for this patient?
Sorry?
ECG?
ECG, yep, unavailable.
Unavailable. Spirometry?
That's a good question. Not available.
Okay. Finger prick blood sugar levels?
Not available.
Urine dipstick?
Not available.
Okay. Could I have some point of care INR? for this patient?
Not available.
Not available. Okay.
Okay.
Any
We've got about 3 minutes left.
Okay. Now, Bill, I'm very concerned about you. I think you've got what we call a deep vein thrombosis. Have you heard of that before?
A DVT, yeah, I've heard about those, yeah.
Yeah. This is a condition where there is a bit of clots within the blood vessels in the lower legs. So I think you might have a bit of clot on your left leg. It is important I manage that as soon as possible. You're quite far away from the nearest hospital, but I will be starting you on some anticoagulants. I'll start you on clexane. What do you think about that?
Sure, Doc. What's clexane?
So clexane is a blood thinner. So what it does is help to thin out the clots that is forming at the back of your left leg. So it's
So I just take that and go home?
No, you can go home. You're very sick. So I'll give you that, and I would against ambulance transfer to take you to the nearest hospital. I know it's quite far away. Have you got anyone at home that you would like to discuss this about with before I call you?
No, I live on my own.
Have you got any friends, family around interstate that we could call just to let them know what's going on?
I've got some elderly parents, but I mean I don't want to worry them at the moment, Doc. I just just tell me what I need. Okay.
So what you need now is an anticoagulation, which is a blood thinner, so I will give you that. And I'll do some more blood tests and some investigations. I would like to do what we call a Doppler ultrasound to see where the clot is. And then I'll also arrange an urgent hospital transfer for you to go to emergency because you do need ongoing. I'm not sure why you had this clot to start with, but I'm really concerned. So we need to know why you have the clot, and we need to put in a plan. I need some further assessment with medical specialists. What do you think about it?
Sure. I mean, if that's what I need, Doc, if I need an ambulance, so.
Yeah, sure. I'm quite worried about you. Yeah. And then once you're out of the hospital, I would like to see you again. I'll talk a little bit more about your weight. You're quite overweight. And the need for you to have a bit of more exercising, some dietary changes, just to get you some more healthy and lose some weight. What do you think about that?
Oh, give it a go.
Okay. Any questions at the moment? Good. Any questions?
Excellent.
Thanks. Time up.
It's Elizabeth, isn't it? Elizabeth.
Yeah.
Yeah. Well done. All right. Good. So, how did that feel? How did you think you went then?
I think I was able to complete my task. But I think I could do better with the patient education and safety net.
Yeah. So come back to tell me what else you think you did well.
So I was able to recognize that he was quite sick and he needed budget treatment, and I was able to cut the AC shots. And I think I got the I was pretty spot on the diagnosis early.
Yes.
And I didn't waste time with other things on the history. Yeah.
And sorry, the lines broke up a little bit. I missed a couple of things there. What did you think you would do differently next time?
Probably a bit more structured.
Mm-hmm.
Yeah,
that's all right. That's why we do these. And I think when everybody, when you're under the pump, it's the structure that goes. So I think, thinking in your head about how you progress through your questions, and I often group questions in my head. But so that's it's a good learning point to have now. Good. Look, you did well, and you got a lot of the key points. So the first one, as you said, there was to recognise that this was one of the red flag presentations, that he was presenting acutely unwell, and most of that was in the physical examination signs. In fact, I think this case was pointing to pulmonary embolus as well as a DVT with the tachycardia and the breathlessness. And you quite well then went to think about how you were going to manage this patient in a rural context, which was good. Good. So, any questions?
So it looks like Lisa Guan's asked questions. So should you need an IVC and oxygen? So yes, if it's giving you any feedback, Elizabeth, it would probably be with regards to your management plan. So your history was quite reasonable, as was your request for examination findings. You can waste a bit of time if you ask for everything. So try and think about, like, the ECG was a good one to ask for, but probably in the context of this, if you think about if you were seeing this patient in your rooms, you probably wouldn't be doing a urine dipstick on them. So don't waste 30 seconds asking for stuff that you actually is not going to change how you're going to manage them. Get on and get your points through management. And with regards to management, so you realised that you were 2 hours away. As for whether you need an air ambulance, Jan, I can see you've asked, look, that's going to be in relation to where you're working. I think it's important that you say, you know, I'm concerned that you've got a life-threatening illness. I think you've got a pulmonary embolus. You need an ambulance to take you immediately to hospital. And at the moment, your oxygen levels are low, so I would put oxygen on. Obviously, people that have had a pulmonary embolus are at risk of collapse. Giving the Clexane now or in an hour is probably not going to make a huge difference, but putting oxygen on and having an IV line in case you need to give fluid boluses. And also you might want to mention that if you're 2 hours away, you might, depending on the skill of the paramedics, you might actually be going with this patient in the ambulance to the hospital.
All right.
But otherwise, I think that was, I think you would have passed that station.
All right, thanks for that. Yeah.